This is a common case that you will see, administering intramuscular injection to the patient. But hopefully, all of you will be trained enough and you will be good doctors, so you will avoid any complications during this procedure. In this case scenario, just look at the second paragraph. After the doctor has given the intramuscular injection in the gluteal region, the patient experiences loss of sensation below that knee and also foot drop. So just imagine the situation that the patient has come for a simple intramuscular injection, but when he's leaving the doctor, he's got both a sensory and motor paralysis. So can you tell me which is the structure that is affected during this procedure? You can just give a guess. Okay, you can type in the chat. Yes, very good. Some of you already know the answer, that it is caused by injury to the sciatic nerve. So this is a scenario that is sometimes seen in the clinical field. Maybe a junior doctor who doesn't know the anatomy very well can end up with such a complication. So when I'm training you to be able doctors in the future, I would like each of you to be thorough with today's class, because once you know the anatomy of this region, you will be able to know how to do the proper clinical procedures as well in order to serve your patients. So let's start today's topic. The gluteal region, the boundaries are given in this diagram. I want to highlight the supracrystal plane, or it is the plane which passes through the highest point of iliac crest. And all of you need to know the vertebral level. It is at L4. And these are the other boundaries of the gluteal region. These are the surface landmarks. So medially, there's an intergluteal cleft, and inferiorly, the gluteal fold. Laterally is a bony landmark, which is the greater trochanter of the femur. Now let's take a look at the bones which are present in the gluteal region. You all know that it is the hip bone, which you learned in osteology class. So I want to draw your attention to the greater sciatic notch and the lesser sciatic notch, which is separated by the ischial spine. In the living, you can see that the greater and lesser sciatic notch, they are actually converted into greater and lesser sciatic foramen with the help of two ligaments. You can just pay attention to this diagram. There is the sacrotuberous ligament and the sacrospinous ligament. Now, the gluteal region is connected to other body cavities, if you will. Okay, these arrows depict how the gluteal region is present in this posterior aspect, this posterior view of hip bone. Just look at where this arrow is emerging from. Okay, through greater sciatic foramen, the gluteal region is connected to the pelvic cavity. Whereas lower down here, in relation to lesser sciatic foramen, okay, you can see the gluteal region is connected to an area called the perineum. So these are the communications of the gluteal region. Why this is important for you to know is because there are certain structures within the pelvic cavity which will emerge out through the greater sciatic foramen. They will wind around the ischial spine and then enter into the lesser sciatic foramen. So note that course in your mind. Now, these structures, we call them the PIN structures. That PIN is just an acronym that stands for pudendal nerve, internal pudendal artery, and nerve to obturator internus. So you can see the course in this diagram. You can see how the pin structures are winding around the ischial spine. Okay. Okay, I'll just pause the class. I think there is something some students need to be entered to enter. I'll just give me a minute. Okay, so let's just continue. Now this is cutaneous nerves of gluteal region. It is something that you can learn if you are interested. It is sometimes asked as a higher level question. So how you will learn these cutaneous nerves is that you need to divide the gluteal region into 4 different quadrants. So this would be the upper lateral quadrant, the upper medial quadrant, and so on. So when you divide the gluteal region into these quadrants, it'll be a little easier for you to learn these cutaneous nerves along with their root value. If you're able to remember these names, you can learn. Now, the deep fascia of the gluteal region is called the gluteal fascia or gluteal aponeurosis, and it is present over the gluteus medius muscle. This deep fascia will split to enclose gluteus maximus and tensor fascia lata. Now, in the region of lower back, there's another fascia called the thoracolumbar fascia. Okay. Now, the muscles of gluteal region, just know that there are 2 layers. This is not the conventionally taught method, but I just want to tell you that there are 2 layers in the gluteal region because the function of these muscles you can learn based upon these layers. So the superficial layer consists of extensors of the hip joint as well as abductors, whereas the deep layers, the muscles of the deep layer, they are called the lateral rotators of the hip. So let's start with the most superficial muscle in the gluteal region. So can you tell me which muscle is this? Spotter for you. Very easy. Please type the answer in the chat. Which muscle is highlighted in green? Yes, it's the gluteus maximus muscle. Now today we're going to learn a lot of muscles in this region. So I want you to learn the details of these muscles today itself. As with any muscle, you need to know origin, insertion, action, and nerve supply. Each of these muscles are important, both clinically and also for your exam point of view. So learn it today itself, and it will be easier for you to revise. So the muscles of superficial layer, you're seeing gluteus maximus, whereas we see a part of gluteus medius here, and deep to these muscles, but still included in superficial layer is gluteus minimus. And also for completion's sake, there is the tensor fascia lata, which will be present in the lateral most aspect. But some authors include tensor fascia lata in anterior compartment of thigh. So you can just mention it as being present in the gluteal region, but the major muscles are the first 3. This is the diagram of the hip bone to just show you the gluteal lines. If you notice from the greater sciatic notch, there are 3 gluteal lines, and the inferior gluteal line marked in yellow. The inferior gluteal line travels from greater sciatic notch up to the anterior inferior iliac spine. The anterior gluteal line in purple, it is marked from greater sciatic notch up to a point on iliac crest called the iliac tubercle. and the posterior gluteal line, which travels up to the dorsal segment of iliac crest. Now, this is a very important point. You need to know the position of the gluteal lines because the gluteal muscles, which we just mentioned, they take origin from the gluteal surface of the hip bone in relation to these gluteal lines. So you can see that the gluteus maximus muscle takes origin posterior to the posterior gluteal line. The gluteus medius takes origin between the anterior and posterior gluteal line, and the gluteus minimus muscle between the inferior and anterior gluteal line. So once you learn this, it is easy to learn the origin. Gluteus maximus origin, it is also having a wide origin apart from the gluteal surface of ilium. It also takes origin from the iliac crest, dorsal segment, from the dorsal surface of sacrum and coccyx, from the sacrotuberous ligament, and also up here from the thoracolumbar fascia. Insertion of gluteus maximus, you can see in this diagram. Okay, 3/4 of its fibers get inserted into iliotibial tract, and 1/4 get inserted into gluteal tuberosity of the femur. So what is the nerve supply of gluteus maximus? These muscles in gluteal region, they're supplied by branches of sacral plexus. So what is the nerve supply of gluteus maximus muscle? Yes, it is by inferior gluteal nerve. Good. Inferior gluteal nerve. And what is the action of gluteus maximus? Okay, it is depicted in the second picture here. Okay, what is the action? Yes, extension. Please, students, every time I ask you the action of a muscle, you have to mention acting on which joint or which region of the body. Yes, chief extensor of the hip joint, correct. So you can see when you stand from sitting position, there is extension of the hip as well as extension of the trunk over the hip joint. So gluteus maximus muscle is the powerful muscle. You saw it is a bulky muscle. So it helps in these actions. Good. And also, I told you that gluteus maximus is inserted into iliotibial tract. So through iliotibial tract, it has an additional action, which is to stabilize the knee joint in standing position. That is also important. Now, this is just for completion's sake, the tensor fascia lata, you can see labeled in this diagram. In posterior view also, it will be seen in the gluteal region. You can learn its attachments, sometimes kept as a spotter question. And its nerve supply is the superior gluteal nerve, the tensor fascia lata. Okay, now we come to the really important part of today's class. Okay, I know I keep saying this, but please learn it well if you want to perform well in your exam. So structures under cover of gluteus maximus. There are bones, ligaments, bursae, muscles, vessels, and nerves. So this can be asked as a short essay for you, or it can be asked as the major viva discussion topic. So just look at the bones in the gluteal region. Okay, here is the ischial spine. This is ischial tuberosity. And this is the greater trochanter of the femur. These are the major bony landmarks. What about the ligaments in the gluteal region? I had already mentioned there is the sacrotuberous ligament between the sacrum and the ischial tuberosity, and sacrospinous ligament between sacrum and the ischial spine. Now, for those of you who are aiming for a distinction or those who are interested to learn a little extra, sometimes this will be asked to you, what is the morphology of the sacrotuberous and sacrospinous ligament? Now, what is meant by this question is that it is believed that in lower creatures, these ligaments were actually a muscle. But according to evolution, these muscles have then converted themselves into ligaments within the human body. So sacrotuberous ligament is said to be derived from the long head of biceps femoris, and sacrospinous ligament from a muscle called the coccygeus. This is a muscle of the pelvic floor. If interested, please learn that. Now, what are the bursae in the gluteal region? Okay, bursa means it's a sac that is lined with synovial membrane, and it prevents friction between bony prominences. So you can just learn the names of the bursae, that would be enough. You can see in the diagram, there is a gluteofemoral bursa. Then there is the trochanteric bursa over the greater trochanter, and ischial bursa over the ischial tuberosity. So when you are sitting down, the bony landmark, which is in contact with the surface that you're sitting on, is the ischial bursa. So in people who have a profession of sitting for a long time, this ischial bursa can get irritated and inflamed, which causes pain and discomfort. So that condition is called ischial bursitis or weaver's bottom, because a weaver is the person who will be sitting on the floor and doing his work. Okay. Those were the bursae of the gluteal region. Yes. Now, the other muscles which I had mentioned, okay, the superficial muscles of the gluteal region are also seen deep to gluteus maximus. See in this diagram, gluteus maximus is cut and reflected. So the muscles that we're seeing deep to it is gluteus medius and gluteus minimus. Okay, when explaining muscles under cover of gluteus maximus, you can avoid mentioning tensor fasciae lata. Okay, delete that point. Gluteus medius and minimus will be seen deep to gluteus maximus. So you told me that gluteus maximus is the extensor of the hip joint, whereas these gluteal muscles, gluteus medius and minimus, will be abductors of hip joint. Okay, so remember that the action of the other two gluteal medius, the gluteal muscles, are abduction of hip joint. The origin of gluteus medius and minimus I had already mentioned, from the gluteal surface of the ilium. What about the insertion of gluteus medius and minimus? Where is gluteus medius inserted? Type the answer. Yes, good. Greater trochanter, or more specifically, an oblique ridge on greater trochanter. And gluteus minimus is inserted into anterior aspect of greater trochanter. What is the nerve supply of gluteus medius and minimus? Nerve supply? Superior gluteal nerve. Very good. So if you can remember, though gluteus maximus is the larger muscle, it is supplied by inferior gluteal nerve, and the other muscles are supplied by superior gluteal nerve. Action I have already mentioned. Okay, this is just for completion's sake. These are the details of the muscles. It is already given in your textbook. This diagram shows you gluteus medius separately, and this diagram shows you gluteus minimus. You can see how it's taking origin from the gluteal surface of the ilium and getting inserted onto greater trochanter. Now, this gluteus medius and minimus has an additional action as well, which you need to know clinically. Look at the last action. The gluteus medius and minimus helps to tilt the pelvis while walking. Okay, so that I'll mention with this test. It is called the Trendelenburg sign or Trendelenburg test for the gluteal region. Okay, so just look at the gluteus medius muscle, okay, of the right lower limb. When the left foot is off the ground, as within the action of walking, the right gluteus medius muscle will contract, which keeps the pelvis of the left side elevated. Okay, if you want to observe this in your own body, you can try placing your hands on your hip, okay, on your hip bone when you're standing. And when you are walking, when you raise one leg to take the next step, the pelvis on that side will actually be elevated above the horizontal. Okay, you can try that. So that is done by the gluteus medius muscle. So remember, gluteus medius muscle of the right side prevents the pelvis on the left side from dipping downward. Whereas if the patient has weakness of gluteus medius on the right side, when he raises the left lower limb, the pelvis on the left side will dip downward. Okay, so I want you to learn this. This is called the Trendelenburg sign. If you understand the action of gluteus medius, it will be a little easier to learn this function. It's given in your textbook. So please learn that. Now in dissection, this is just to show you, this is gluteus maximus muscle. And when you reflect that, deeper to it is gluteus medius, and the deepest muscle is gluteus minimus. But all these muscles are considered to be superficial muscles of the gluteal region. Okay, now we're going to learn the other structures within gluteal region. So I want you all to learn the diagram in your textbook, structures under cover of gluteus maximus. So you can see there are a lot of structures that you have to learn. So in order to help you in memory, or rather just to keep you awake for this class, I guess, there's just, okay, I'll show you a few pictures and that will help you to correlate with the names of the structures in the gluteal region. Okay, so after gluteus medius muscle, there comes a pear-shaped muscle, which is called the piriformis. Okay, the word piriform means pear-shaped. Now, when you are learning these pictures that I am showing you, they will keep multiplying. Okay, so right now it's one pair. So the next structure will come in twos. Okay, so the next structure that you're going to see, it's like a pair of twins. Okay, twins is called Gemini. Okay, the sign Gemini actually refers to the twins. So there is a muscle, okay, rather there are two muscles which are called the gemelli. There is the superior gemellus and the inferior gemellus. But once you take a closer look at these two structures, you realize it's not two, but it's actually three in number. Okay, that's called the tricipital tendon. The superior and inferior gemellus, they have a tendon in between. So together, the three of them, they are called the tricipital tendon. Then the next muscle that you're going to see, okay, to learn that name, you need to remember the quadrangle or quadrate, okay, which is the number 4. That is the quadratus femoris muscle. And then there is also the origin of hamstrings. Hamstrings are the muscle of the posterior compartment of thigh that takes, you can see the origin of hamstrings in the gluteal region. Now, yes, class, you can learn something from all these people who have gathered here. Yes, because though there are a lot of people, you know, they always maintain a pin drop silence that represents the pin structures in the gluteal region, which I had mentioned earlier. So this is just something silly to just familiarize you with the names of the structures in the gluteal region. Okay, so this is the actual diagram that you have to learn from your textbook. Okay, so here the outline is for gluteus maximus muscle. This is gluteus medius, piriformis. These are the two gemelli. And in between the tendon is the tendon of obturator internus. So together they're called the tricipital tendon. Below that, you can see quadratus femoris is marked. This is the origin of hamstring muscles. And this is just the nerves and vessels present here, medial most. It is the pin structures. Okay, so in today's lecture, I'll be dealing with the muscles in the gluteal region. For tomorrow's lecture, we will learn about the vessels and nerves in the gluteal region. The sciatic nerve is a nerve that you have to know in detail. We'll deal with that tomorrow. So I've already told you about the gluteal, okay, the superficial muscles in the gluteal region. They are called the extensors or the abductors. So I think I'll just show you a small video. Okay, so just hold on. I'll get the video for you. Okay. Now we come to another important part of the class, which is short lateral rotators of the thigh. So far, we saw the gluteus maximus is the extensor of hip joint, and the other gluteal muscles are the abductors. Whereas these deep muscles that we're going to see, they are called short lateral rotators of the thigh or the hip. So this can be asked as a separate short note for you. So here you can see the muscles I mentioned previously. Now some authors also include obturator externus muscle along with short lateral rotators. If you remember, obturator externus, okay, you had learned it in which compartment of the thigh? You can type that answer. Obturator externus muscle is present in which compartment of the thigh? If anyone remembers from dissection class. Yes, good. Obturator externus, you had learned in adductor compartment or medial compartment of the thigh. But as you can see in this diagram, the tendon of obturator externus will just have a short course within the gluteal region. Also, what is the action of obturator externus? Though it is present in the medial compartment, what is the action of obturator externus? Lateral rotation. Yes. Lateral rotation of, yes, lateral rotation of thigh or lateral rotation of the hip. So that is why it is included within this group called short lateral rotators. Let's look at the piriformis muscle. Piriformis muscle is known as the key muscle of gluteal region. So just a revision for the students who know this. Okay, why is piriformis muscle known as the key muscle of gluteal region? You can type the answer. Why is piriformis muscle known as the key muscle? Okay, so in your exam, how will you identify piriformis muscle? See, this is the, yes, large nerve called sciatic nerve. Yes, very good. Basil has given the answer that the nerves and vessels in gluteal region, they are named in relation to piriformis. So at the sciatic nerve, you can see, is emerging from lower border of piriformis muscle. This is how you will identify the piriformis. Okay, it's piriformis muscle is called the key muscle because nerves and vessels in the gluteal region are named in relation to piriformis. Okay, in relation to piriformis means, see this nerve emerging from the inferior border of piriformis. It is called the inferior gluteal nerve, branch of sacral plexus. Whereas superior to piriformis, there will be the superior gluteal nerve and also superior gluteal vessels. We will learn those details a little later. So this is an important fact that piriformis is known as key muscle of gluteal region. So can you tell me the origin of piriformis? Okay, I think it's just given in this diagram. Piriformis takes origin from the pelvic surface of the sacrum with an E-shaped origin. So it's actually from the sacrum. It's a single bone, but it's actually a fused vertebra made up of 5 segments. Okay. So the piriformis takes origin in relation to S2 to S4. What about the insertion of piriformis? Okay, here you can see the origin and look at the insertion. Where is piriformis muscle inserted? Tip of greater trochanter. Good. What about nerve supply to piriformis? The gluteal muscles we learned, they are supplied by inferior and superior gluteal nerves. What about nerve supply to piriformis? Type the answers fast so we can move on with the class. Ventral rami of, yes, when you say ventral rami, that's a very general term. Okay, yes, they're actually branches of lumbar, okay, the lumbosacral plexus. Okay, the lumbar plexus is actually extended to form lumbosacral plexus. So from sacral plexus, the S1 and S2 nerves, ventral rami, supply the piriformis. Some books say L5, S1, S2. So please remember the root value for nerve supply. And the action of all these muscles, you know, is lateral rotation of the hip. Next, we will learn about obturator internus. What is the origin of obturator internus muscle? You see it in this diagram. Obturator internus muscle takes origin from yes, you can practice your typing skills, type really quickly when you know the answer. Yes, anyone with the answer? Origin of obturator internus. Yes, obturator membrane. Yes, pelvic surface of obturator membrane. Along with that, adjoining bones also. Okay, the obturator membrane along with adjoining bones gives origin to obturator internus. Now, the insertion of obturator internus is into the medial surface of greater trochanter. There's a common insertion for obturator internus and the gemellae. What is nerve supply of obturator internus? This is a very easy question. Nerve supply of obturator internus. Yes. Nerve supply is by nerve to obturator internus. Among the pin structures, the nerve to obturator internus supplies this muscle. If interested, you can learn the root value. Okay, this is just the details of the muscles. It's given in your textbook, so please learn it. What about the gemellae? Superior gemellus, you can see it takes origin from the ischial spine. Now the gemellae insertion, okay, suppose, just look, this is the superior gemellus. It is actually getting attached to tendon of obturator internus. Similarly, the inferior gemellus insertion is also tendon of obturator internus. So that's how it forms tricipital tendon. There'll be a single tendon here formed by these 3 muscles. And finally, the 3 will get inserted onto medial aspect of greater trochanter. Now, nerve supply of the gemellae is also important. See, superior gemellus will be supplied by nerve to obturator internus muscle, whereas inferior gemellus will be supplied by nerve to quadratus femoris. So these gemellae, they actually receive the nerve supply in relation, okay, in corresponding with the adjacent muscles. So please learn that. Yes. Quadratus femoris finally, okay, takes origin from ischial tuberosity and is inserted onto the femur in a part called the quadrate tubercle. The femur on the posterior aspect of upper end, this is greater trochanter, lesser trochanter. This is called intertrochanteric ridge. And this is the quadrate tubercle, which gives insertion to quadratus femoris. What is nerve supply of quadratus femoris? Nerve supply of quadratus femoris. Okay, nerve to quadratus femoris. Yes, these are all branches of sacral plexus. So if possible, you can learn the root value as well. If it's too difficult, it's okay, but if possible, learn that. Now, finally, obturator externus. Obturator internus, you had told it takes origin from the inner surface of obturator membrane. So obturator externus takes origin from the outer surface of obturator membrane. Now, the insertion of obturator externus, you can just remember on the medial aspect of greater trochanter, there is a depression called the trochanteric fossa. The trochanteric fossa gives insertion with the insertion point of obturator externus. Okay, this is very important, trochanteric fossa. What is the nerve supply of obturator externus? Nerve supply of obturator externus. Very good. Aksa, very good. Okay. Nerve supply of obturator externus is by posterior division of obturator nerve. So I think I mentioned earlier that obturator nerve itself is a short note for you. So you learn about its course, its divisions, branches, and distribution. Okay, so when you're writing this for your exam, you can just mention that obturator externus, it is anatomically belonging to the medial or adductor compartment of thigh, but functionally it belongs to the gluteal region. And it is the tendon of obturator externus, which is related to the gluteal region. And the action of obturator externus is lateral rotation of the thigh. That is why it is included along with the deep muscles in the gluteal region. So let's go back to our clinical question. Okay, when a patient comes for intramuscular injection, you know that one site of intramuscular injection is in the gluteal region. So based on this diagram, okay, you can see the syringe is placed at a particular quadrant in the gluteal region. So which muscle is getting pierced by the syringe during intragluteal injection? Okay, this is, just look at both the diagrams and tell me, the syringe is actually passing through which muscle? Yes, good. Even though it's an intragluteal injection, the syringe passes through gluteus medius muscle. Okay, that's very important because we learned so much about gluteus maximus. We might say the answer is gluteus maximus, but actually it is gluteus medius. So when giving the intragluteal injection, you have to divide the gluteal region into 4 quadrants. So out of these 4 quadrants, you can see the nerves are present. Okay, the nerves of the gluteal region is present in the inferomedial quadrant and the supromedial quadrant. And in some individuals, the sciatic nerve can have a high division. So sciatic nerve may give a branch into the infrolateral quadrant as well. So which is the safe quadrant in the gluteal region? Yes, superolateral quadrant is called the safe quadrant because there are no important nerves in that region. It is only the gluteus maximus, part of gluteus maximus here in supralateral quadrant, but the major muscle is gluteus medius, which is present in the supralateral quadrant. So that is where you have to give the injection. So please keep in mind, okay, when you are giving intramuscular injection, you have to make sure you select the supralateral quadrant. If injection is inadvertently or accidentally given in the infromedial quadrant, And if sciatic nerve is injured, it leads to a lot of sensory and motor effects for the patient. Usually with a single injection, it is only a temporary paralysis. But if there are repeated injections being given to the patient, it is a serious issue. It can even be a medico-legal problem where the doctor gets sued and it affects the life of the patient. So this simple fact, okay, regarding quadrants of the gluteal region is something I want you to remember throughout your profession. And when you go to the clinics, you will learn the technique of how exactly to choose the supralateral quadrant. Okay. Okay, class. So that's it for today's class. Thank you for your patient listening. So